And keeping with other issues in the news, the state of Nigeria's public hospitals and its healthcare sector is going to be our concluding segment on the program. And joining us to review some headline stories is Ben Agunioye, who is an information professional and a public affairs analyst. Now, this is off the back of reports of how migration and certain factors have affected public hospitals, with even the number of health professionals declining from 300,000 in 2017 to just about 90,000 in 2024. Now, for the likes of the University Teaching Hospital in Ibadan, the UCTH, it has spent 107 days without electricity. Now, patients have been forced to use other alternative sources to find power in being able to obtain treatment. Now, even on the part of the federal government in terms of promises made to Nigerians, ending the year 2024, 3 months ago, Nigerians were elated when the federal government said it was going to be giving free Caesarean sections to expectant mothers. But up until now, we hear that no patient has met the criteria. Now, if we have the connection secured with Mr. Ben Agunioye, let's begin this conversation. Hello, Mr. Ben. Good morning to you. Mr. Ben, can you hear us?
Yes, I can hear you. Good morning.
Good morning. Welcome and thanks for joining us on the program. Now, Mr. Ben, I know you to be someone who's been very objective of issues, especially when it pertains to healthcare. This morning, a few newspapers are looking at it from different perspectives. And to start with, the worrying situation with a decline in the number of health professionals. Statistics say in 2017 there were about 300,000, and last year that number dropped to 90,000.
Well, you cannot beat statistics, but we also need to look at it in clear terms. What is our capacity to produce new set of people? What efforts are those in charge who are responsible for these activities doing? Movement of labor is not what anybody should restrict. It's not what any nation in the world has been able to also restrict. But we as a nation should not be caught in that way, because we have the population, we have the people with the intelligence, and so our focus should be on rapid development. It doesn't matter if they leave the shores of the land, but if we stay at developing and developing, a country like Philippines does not keep their people at home. They run their economy with remittance, with diaspora remittance. And so we should look at the fact that the rest of the world wants something from us is an advantage. And I think that we should take a good advantage also of the fact that, okay, maybe the president has extended to say, look, those who are getting aid, they no longer can japa, is it not? Extend their age limit to 65, but let's also provide them with the resources and materials required to rapidly develop new people. And then, of course, when you also look at our recruitment, particularly in the public sector, it's not been in favor of the general masses. Sometimes it's been the children of the privileged and the high and mighty. Now, these are also the same children who have all that it takes to go out with ease. If you employ somebody that needs to build resources for 3 to 5 years before he can japa, I tell you that he will focus on his job for that 3 to 5 years, and even before he is leaving, we would have been able to provide others that will replace them. So I think that our problem is not with the movement of labor, but it's with the process of producing and our process of recruitment. We have capacity to produce, we have capacity to recruit right, but I think that we are not recruiting right, and we are not developing that potential to produce new people.
Now, at a time when there are so many calls made for PPPs in Nigeria, different sectors of the Nigerian economy, including the health sector, some experts have sort of suggested that the government should privatize specialist hospitals, for greater efficiency. Now, do you think this is perhaps a viable solution to the problem that our health sector continues to grapple with? On one hand, the presidency has, or the president has increased the retirement age from 60 to 65 years of age. But is this also enough to help the health sector from this depleting state that it is currently in?
Well, if you ask me, should PPP target the existing government hospital? I don't think so. Why I'm saying that is because we don't even have enough in the first place. We don't have enough. How many private organizations in Nigeria have their own clinic? I know that when you go to a nation like Egypt, as far back as 2004, what they call the Clinic for Egypt Air had more equipment than virtually all the tertiary hospitals in Nigeria. Because at the time, no hospital, no teaching hospital have 2 linear accelerator in Nigeria. But that clinic had 2 linear accelerator, but they still call it clinic. Everywhere you go in Egypt, you see what you call even the children cancer hospital. So in terms of number of hospitals, I think we don't have enough. So rather than people struggling to take over what government has already built, I think PPP target should be to build new standard in your hospitals, which they can now run. Of course, it is okay that we can say there are inefficiency and wastage in the public sector. So we should do whatever can be done to cut the wastage. Sometimes when you transfer from public to private, the wastage remains there. We have privatized power for how long? But people are still paying for darkness, and we still don't have meters. So it's not about shifting it from government to private. No, I think it's about defining the efficiency, defining the outcomes. What will be the outcomes? I think that's where it goes. Sometimes you bring in the private sector and the only thing you see is change in price. There are not much other things. Like I said, increasing the age to 65 is a good one, but we need to cash on that immediately and ensure that these people who are 55 and above, who will likely not japa, can stay back over the next 10 years and build a new base.
Now talking about electricity, Mr. Ben, talking about electricity, the challenge with UCTH in Ibadan, having spent over 107 days without power, has been called into question at a time when the government had promised to also have some tariff reduction for tertiary health institutions and schools in Nigeria. I don't know what you make of this disturbing development.
Well, that they have no power is sad. That we are talking about tariff for tertiary health institutions is also wrong. I would think that we should take them off the national grid. The minimum will be a mini grid or an off grid. Yeah. All tertiary health care should not be on the national grid as far as I'm concerned, because the grid itself cannot guarantee that it will not collapse. And in the tertiary health sector, I think that they need the stable supply power. So we should be talking about, and the 100 days for which they have been without light was sufficient to have done a transition. So I think the focus should not be about tariff reduction or what you do around the grid. It should be that you transit them. Not just
why I ask Mr. Ben is because when we talk about this issue, the federal government is quick to quote numbers. Last year in September, they told us over 188 billion naira was paid as subsidy for about 75 public hospitals and over 30 universities in the country. And they were talking about it off the back of going into 2025, they would need to remove all subsidies for electricity, be it for tertiary hospitals.
I think those figures are there, but I'm not interested in what subsidy you are paying for the universities and for the tertiary health care. All federal medical centers and all teaching hospitals, as far as I'm concerned, the only thing reasonable is to take them away from the national grid. It's not about what subsidy you are paying. For me, it is that take them, set a date for all of them to go away from the national grid. Give them a mini grid or set up an off-grid system that will run them, independent of anything coming from outside. Until we have done that, we are not ready.
Mr. Ben, with this call you have made, do you think that somehow the over $1 billion earmarked for the health sector in the 2025 budget will sort of, to a certain extent, solve this issue of power in our health sector, especially in our hospitals? Case study UCH in Ibadan that you have mentioned just now.
No, clearly speaking, I think that whatever has been earmarked for them should also go into equipment. Equipment-wise, whether it's the test equipment, both diagnostics and therapy, I think we are not there. So they should spend their money to acquire that. But there is the rural electrification scheme. There are other money that we have voted into power. There are other things coming from that sector. So we should take the university as villages under the rural electrification scheme. And so the budget for power should not be from health, but should be from the rural electrification scheme. If you cannot do all of them at the same time, decide the number you are doing. But like I said, let's set a timeline by which they will exit the national grid. And they must exit the national grid because the grid is not reliable and cannot be trusted.
There are certain opinions or different opinions with regards to this huge or humongous amount of money earmarked to the health sector in the country. And one of many such individuals that has raised concerns about this is former Vice President Alhaji Atiku Abubakar, who called for an audit into the over $1 billion earmarked, citing that we shouldn't have cases or issues of animals swallowing monies like we have seen in the past with certain MDAs in the country. How do you think modalities can be put in place? And what modalities do you think can be put in place to ensure strict scrutiny of these funds and ensure the proper usage of the funds to better our health sector?
Yeah, I think it's not just about glossing over the surface. You have people in National Assembly who have oversight function for these things. The budget passes through them every year. So if equipment and the budget are not purchased, the National Assembly members, for me, should be held responsible because they have oversight function to see that these things are done. So if they do not see that and they approve new budget, then we need to call them to question. And somewhere down the line, even if they have finished their term and they are out, we should have a process that can hold them responsible for their inaction while in office. We know there are wastages, but we need proper monitoring. So now we look at what is the budgeting process, what is the fund release cycle, and who is there to monitor it. What are our civil society organizations doing? As far as I'm concerned, they should do more than just making noise or doing rallies. Let's have data. This is what we budgeted. This is what was done. This is what was not done. So we know what the gaps are. It's not about the size of the budget. It is about what is the actual impact. What are the wastages that we need to remove? And when that is put in the place, then I think we will get better value for whatever money is going into the sector.
Mr. Ben, you were talking about CSOs and the role they play in ensuring close monitoring and accountability when it comes to monies being spent by certain MDAs. We saw just this morning in the news where Serap had sued the president over his failure to investigate over 100 billion naira fraud projects by certain contractors in about 31 MDAs across the country or something like that. If more organizations like SERA come up to hold government-elected officials accountable, or even the MDAs themselves accountable, do you think we might just begin to see an end to this debacle of corruption and fraud within our MDAs that continue to hinder or stunt the growth of sectors like the health sector in our nation?
Yeah. If you ask me, I think that I would rather believe that Sarah, rather than sue the president and the AGF all the time, sue the specific MGAs and get actionable judgment. If you get what I'm saying, if that happens, I am sure that we are going to get better results. When the MDAs know that people will ask them questions, the president has immunity, the governors have immunity. So why sue somebody, an office that has immunity, when you actually can get hold of that particular MDA, where the MD or anybody there does not have immunity, you get an actionable judgment, and then we begin to use the court process to enforce it. And government will eventually begin to sit up and look at things better.
Now, Mr. Ben, talking about government sitting up and doing things better, a lot of persons applauded the government last year when they declared free cesarean sections for expectant mothers in Nigeria. But 3 months down the line, monitoring and implementation has fallen short as Nigeria continues to grapple with maternal mortality. We're hearing that no patient has met the criteria so far. Whilst there are MOUs with certain states, there's still a referral list that is being awaited from states. What do you make of this development?
Well, again, if you come to that, I would say that we've got so many NGOs in the health sector talking about mother care and the child care. So for me, therefore, if government has come up with a policy, even if the government itself does not have the ball to run it through, because they have made the statement, the NGOs who are there in the health sector, raising international funds, raising local funds, should begin to gather the data. If you now say, okay, these are the bottlenecks, then we should have advocacy on how to meet up and ensure that people who should be due for these services are getting them. Healthcare is not something that can wait forever. A woman is pregnant only for 9 months. And sometimes even before you discover she will need a CS, might be something that has to be done between 5 and 10 days. So I think that the fact oiling the process, the wheel of the process, the NGO has a role to play. Yes, the government is the big elephant in the square, but we need to ensure that the processes that is required for the people to get the right services are provided. If it will need some measure of technology, maybe in data gathering and in approval process, it should be identified, and then that should be worked upon. Most times when you just pass policy and you write bills, they just stay there gathering dust. So there has to be an intermediary, and like I said, the advocacy group and the NGOs in the health sector are so many that you would expect that there shouldn't be gap.
Now there's a difference in opinion on the state of our healthcare, because last week we saw comments coming in from the National Association of Resident Doctors, Chief Medical Directors, and the opinion of the Vice President on the state of our health, where the Vice President said, in terms of medical tourism, citing the case of 13 internationals who came for kidney transplants in the country, he says that our health sector is much improved. But for NARD and the CMDs, they're saying that remuneration is not as it should be. What do you say of this difference in opinion on the state of our healthcare?
You say 13 people came. When you check the medical tourism between 75 and 79, right? And then you check what is happening today, you will know that it's a far cry. When you check our universities up till 1993, you will see foreign students everywhere. How many of that do we attract now? So that we are not doing well at the moment is not a wrong statement. When you also come to those who are talking about remuneration, have they compared their remuneration with the minimum wage in Nigeria and compare the remuneration in the countries that they are targeting with the minimum wage in those countries? I think that for us, generally, nobody is well paid, except perhaps the politicians and some contractors. So it is not just a loan set at, and when you also look at your cost, what you need to spend compared to what the person and the other client that you are comparing yourself need to spend is not exactly the same. So, but you need to check, what are we paying the medical people in Nigeria relative to what we are paying teachers, relative to what we are paying other civil servants. relative to what you are paying other professionals like architecture and the rest, you will realize that their remuneration on that platform cannot be considered poor. But when you compare it with a middle income to high income country, then you might say that you are very low if you are comparing doctors to doctors. But if you also compare teacher to teacher or gate man to gate man for those countries, you also know that the rate is low. The minimum wage in the UK is not less than £12 per hour. How much do we pay security in Nigeria? Not all of them are even earning 70,000 per month. So when it comes to the remuneration, I think it has to be put in context, and then we need to look at it. And the truth is that if the remuneration is not okay, I would rather think that some of them should quit the job. There are also people who want those jobs outside who are not employed. I know physiotherapists, I know people in the medical sectors who are underemployed as we speak. They are overworked, they are underpaid in the private sectors where they are. There are vacancies in the public sector that are not declared and are not given to people who are ready to work. So we need to look at the whole process. There is wastage, there is unfair treatment, there is nepotism. So a lot of things are wrong with us. So if we must come to equity, let's come with clean hands. And let's decide to say, okay, we want to do the right thing. It doesn't matter if your father is the Minister of Health or your father is a gate man. The two of you should have the same platform. Come on to do house job. If you are not connected, you won't get to some hospital where you think there are facilities you want to use. So I think a lot is wrong with our development process, with our reasoning, and with the way we put ourselves out there.
But Mr. Ben, still talking about the access to free cesarean section promised to expectant mothers by the federal government about 3 months ago that has not yet come into play. There are certain figures that I want you to react to this morning. Now, in general, Nigeria records about 1,047 maternal deaths per 100,000 live birth. And the Ministry of Health says that they have an MOU with 20 tertiary hospitals, and also citing that no patient has met the criteria for the free cesarean section. With this alarming figure of maternal deaths per 100,000 live births, do you think that perhaps the issue of meeting criteria might just be put aside and the humanitarian angle of this case should be put forth and these women should be helped in the way that they should be? 3 months is too long a time for such a promise to linger on.
Yeah, clearly, like we're saying, what were the criteria that they cannot meet? I think that we should just have, number one, how well have we done with our primary health care? Issue relating to birth should have happened at the dispensary of the primary health care.
Yeah.
So why don't we have a data or a platform that connects a number of hubs of primary health care to certain tertiary hospitals? And when they have a case, it should be that it will be hospital to hospital, not even patient meeting conditions. It is that I am here in Jiwa primary health care. This woman has come in and we have accessed that she needs help of a CS to deliver. If Jiwa is connected to Gwagwalada or to Federal Medical Center or to National Hospital, it is the hospital that pulls a call through and deliver the patient to them for the job to be done. So I don't know what we are talking about criteria. It should not involve the patient as far as I'm concerned. Once I register in the primary health care and I did my antenatal there, everything about delivery should be a process between the two hospitals. A referral from the primary health care to the secondary or the tertiary should not be a duty of the patient. So I don't know what criteria we are talking about if we're actually talking about saving lives.
Well, looking at it holistically, just in a few minutes, we have about 3-4 minutes to wrap up this conversation, Mr. Ben. Let's talk about the stakeholders in this picture now. Talking about the Federal Ministry of Health, talking about the hospitals themselves, and also talking about the healthcare workers who continue to leave the country in droves. Should we also bring into the picture the issue of, or the topic of patriotism? At this point, our health sector is dying, and it begs for quick intervention. Apart from throwing 1 billion US dollars at it, what else can all these stakeholders do to ensure that we salvage this situation?
You see, like clearly stated, the roadmap is this. We need to make our hospitals more ready to do its job. How do we gather our data? How do we get our supplies and equipment? You go to an hospital like the National Hospital and you apply for a test as simple as blood count, and somebody will bill you and collect the money and come back and tell you there is no reagent. How can reagents finish in a national hospital? But because there are no consequences, so people will continue to do what it is. So I think that as much as we need to look at an holistic view, what do we do in the sector? We need to build capacity to train more people. I will always insist on that. You cannot stop people from leading, but you can continue to produce more and more. And some of them will stay back and give back. That is a clear thing. You also need to make the hospital ready in terms of equipment and working condition. And then, of course, clearly, between the ministry, the NGOs, I would always say, the patients, and the administrators across board, there is a need for a new synergy, a new flow of information, so that we can identify from time to time what is the error that needs to be corrected, and then it's adjusted. Like we would always say in the modern world, there is the people, there is the process, and sometimes they need technology to enhance them. So if you marry the three appropriately, our health sector will be great. Nigerians are intelligent, and we are people who are ready to work. So we need to open up our employment system also. Not just that they are the children of the high and the mighty, but employ everybody. I think it was one governor who said in the past, I think around 1982, he said, you don't hire a master, you hire a servant. But when the staff you have recruited are too big for whoever is their boss to control, you actually realize that there is inefficiency. And that is one of the reasons why you see people go abroad for medical treatment that can be done here. Because some of the staffs are out of control. And the same person will now complain that his friend somewhere is earning higher. So like we said, don't stop people from going, but train more people and give jobs to people who are ready to work.
All right.
And then our lives will be better.
All right, Mr. Ben Agunioye, such a very fantastic place to leave the conversation. But it's been quite informative having this conversation with you on the health sector and the situation of primary healthcare services in the country.
You're welcome.
Thank you.